One of our biggest challenges in the CHA process was, I think there's things that most people experience, just keeping people engaged, keeping people motivated. We definitely experienced that. One of the hardest things for us was keeping people on the same page. Throughout the process, because even just the idea of a comprehensive community-based assessment focused on a broad range of health issues and a broad definition of health, and then using that to create a community health improvement plan that would actually be implemented, this whole idea was something that was new to a lot of people. We found that we had to keep revisiting why we were in the room and why we were all there together. We had to keep revisiting our mission and our vision and make sure that those were always in the forefront, so that every activity we did really kind of reminded people of why we were doing it and how all the different pieces were going to come together in the end. That was a lesson learned for us. If we do it again, that'll definitely be an even stronger piece, because it was something we kind of realized as the process went along that we needed to emphasize more, revisit our accomplishments, and keep tying things together throughout the entire process. As a result of the CHA process that we did, we are implementing the Community Health Improvement Plan. We're about 6 months in of implementation. We are seeing some change in our community. We definitely have a core group of folks who are committed to implementing the Community Health Improvement Plan. We also have some new folks on board, so we're continuing to foster those community collaborations and partnerships within our local public health system. The first thing that we've started implementing is really strengthening the information about different resources in our county. That was one of the goals in our Community Health Improvement Plan, one of the strategies, and that's the first one that we've started implementing. For that, we're already looking at current kind of resource guides and sources of information for local resources and looking at how we can strengthen those, coming up with a lot of great ideas. And like I said, we have a lot of people on board, so I'm confident that those ideas will get implemented. We have a really robust plan, and it'll take 5 years to implement. And some things that we put in the plan have already kind of changed. We'll need to make adjustments as we go along. But I do see it being both a collaborative, ongoing process that will benefit the community in the long run. And I think next time we do it, around in 5 years or so, we'll have an even stronger product, and we'll have been able to show the community that we can implement change through this process.
I can't lie, there were some challenges during our CHA process. I would say one of our first challenges was encountered when we were doing our community themes and strengths assessment, where we used a quality of life survey and getting that response rate up. That's definitely a goal of ours for our second iteration of MAPP now. And we did run advertisements in newspapers. We tried to email it out a lot. We had it available online, SurveyMonkey, as well as a paper copy. But we hope to do a lot more advertising and marketing around that this time around, and kind of do a little road show and take it to all of our other civic organizations that are in our community. But we also have, some other challenges with organizations that hear about MAPP and they want to join. And of course, MAPP is open to anyone in our community that has an interest in population health. But we have found in just a few instances, organizations that will come to a MAPP meeting simply to promote their own self-interest. And, of course, we'll put them on the agenda, and we hope to convince them to come back and see the larger picture, to see the whole action plan that has been developed. But that has been a challenge. Well, we have been so excited about all of the successes we've had from our chairmanship. Several of our goals, one example of a success, we wanted to pass a countywide smoking ordinance, and which of course is recommended by all of our national strategies. And we set a goal date for that of 2015. But by having such great partnerships, and one of our strongest partners being our Deputy Judge Executive in Franklin County, Kentucky, Jennifer Wilson, we were able to get that done in 2012. We were able to get that done so easily, after hearing horror stories from other communities. It was amazing to me how easily that was accomplished. And one other huge success that we've had has been with a policy change in all of our elementary schools, which in our community is a county system, an independent school system, and 3 private schools. every single one of their school boards passed a policy requiring every teacher to add at least 10 minutes of physical activity to every school day, incorporating it with the curriculum they already have. And so we were really excited to get that policy passed as well, and hope that that will ultimately help to reduce our childhood obesity problem.
One of our biggest challenges was the potential for conflict and competition between some of our key partners, particularly our three large health systems. Fortunately, the new IRS China requirements, which require the health department to be involved in developing community health assessment for community benefit for the health systems, really helped us out a lot with that. So in our particular situation, our very large local Wellstar health system, Kaiser Permanente, and Emory Adventist Hospital, which is part of the Emory University Hospital System, were deeply involved from the start in all four of our assessments, and fortunately are all three still at the table for implementation. So. Our health department is far stronger and more visible than it was 2.5 years ago. It's been a tremendous boost for us. Obesity is now clearly on the community radar screen, and I believe that everybody's poised to attack. We have dozens of new partners and resources at the table that we did not have a few years ago. An initial implementation of our CHIP is just a few months away. We're beginning to see a few success stories. In Cobb County, Public Health is now on the Strategic Planning Group for Transportation. And as I mentioned earlier, our Wellstar Health System recently completed their China, primarily using information from our MAPP steering committee's assessments. Cobb County Chamber of Commerce now has a very active health committee, which is chaired by our deputy director. In Douglas County, several new partnerships between the faith-based organization, county government, and local hospitals will result in the August 2013 opening of a new community health center, which will primarily serve uninsured people below the age of 65.
One of our biggest challenges was assuming that the barriers that were in place, one, were there, and two, were as real as they appeared to be. And to explain that, in public health, you're kind of people sometimes confuse us with indigent health, and they sometimes confuse us with, we're just an STD clinic or an immunizations clinic, or that's who we call when, we get sick after eating at a restaurant. And so a lot of times people just don't understand what we do. And so we spend a lot of time educating about what public health is and what we do. And so when we embarked on this process, I didn't feel like we would be taken as seriously as we were. And so I thought, oh my goodness, it's going to be so hard to get a coalition together. It's going to be so hard to get 35 people in a room who are CEOs and physicians and all of these people who have such an important role in the community. It's going to be so hard to get them together. And so I put it off. You want to build all this stuff. You want to have everything in place. You want to have all your ducks in a row and be perfect before you move forward. I didn't need to be. I didn't need to have that concern, because between myself, our accreditation coordinator, our director, and our two co-chairs, we called, we asked, we emailed, we have personal connections with all of the people in the room, and they all came. It was amazing. And the first meeting was just overwhelming with how much it was important, just as important to them, if not more, than it was to us. They have the same issues. They have the same want for a healthy community. So it was kind of perceived barriers that may not have been there, because you just assume that politics are going to get in the way, and they didn't, and they haven't for the last 7 months. It's been truly an amazing process. And so I think, just getting over your own presumed or assumed hurdles, and recognizing what they are and just moving forward. I think a lot has changed as a result of the whole process. I think it was important for us that we used the MAPP process because it has been so long. I think if we had just started and did the community health assessment or the community health improvement plan by themselves, they wouldn't be as useful. It would be more like, oh, we've got to get this done for accreditation. And we have sworn, the director, myself, our accreditation specialist, it's been important to us this whole time that it's not just a check in the box. It's not just a stepping stone to accreditation, that it actually means something, because it's a lot of work. It's a lot of mental work and physical work, and it's just really important that it means something other than just a piece of paper saying we're accredited. And so for us, it was important that it was embedded in the MAPP process and that it goes hand in hand with those 4 assessments that we've done, and that we'll continue to do those to really see if things have changed or not changed, and even if we have changed, and maybe understand how each agency works or interfaces, over time. And so that really has been one of the biggest benefits. And I'm glad we used the MAPP process and that we were strategic in what we did. Now, in hindsight, going back to 2008 when we started this, I wish that we would have followed the MAPP process better and actually looked at identifying strategic goals before we started doing the work, so that we kind of had an idea of where we wanted to be before we got there. It would be a lot less challenging. In hindsight, hindsight's always 20/20. But I'm glad we've done it the way we have. It's just we could have been more strategic from the get-go. But we will, in the second iteration.
So I think one important piece that we're already seeing emerging from the process is that we have a very strong School of Medicine in Greater Cleveland, Case Western Reserve. And they realize the momentum behind the HIP Cuyahoga process. And they've been partners with us, but have now invested even deeper in the work that they do in the community with us, and have included the HIP Cuyahoga process in their new strategic plan for the university. So they now have said that this is a priority for us to work with the health department, help support around data, personnel. They have a prevention research center funded by CDC that works with us. So one of the things that's important now is they have to have a medical school see community health issues as a priority for them, and heretofore it wasn't stated as such in a strategic plan. I think is a big deal, and I think the fact that they now have weighed in has made clear to other partners in the community that this process is for real, and they're invested in it, and it has brought, I think, new people to the table, new partners that see now that the process is not a flash in the pan. It's real, and it will bear fruit over time.
And I also think it's enhanced collaborations, even both internally.
Yep.
We're interacting as a staff in different ways that we hadn't normally interacted before, and we're starting to see bigger connections between our programs
Right.
and the way that we're doing business. And it's also sparking innovation in how we can change our mindsets moving forward.
Right.
And it's enhanced our partnerships externally as well. And as we continue, I think, to kind of change the thinking and move the momentum forward, I see that as a win-win as well.
Absolutely.